Dear viewers, we are back from this report and we have been joined by our first guest for this evening, Dr. Sami Ouanes, consultant psychiatrist. Good evening, Dr. Sami, and welcome to Hala Kuwait.
Good evening, thank you.
Thank you so much for being here. Of course, we have a lot to talk to you about, but I think the most important questions to start with is, why do people really need psychiatrists?
In medicine in general, we try to answer questions scientifically, and I think we need to have statistics. So do you know that around 20% of the general population may have a psychiatric disorder, which means that 1 out of 5 people on earth has a psychiatric disorder. So this is very common. Just for comparison, the prevalence of diabetes, which is very common, one of the most common medical conditions, the prevalence is 10%. So psychiatric disorders can be twice as prevalent as diabetes. The second point is that psychiatric disorders are also associated with a very high burden of disease. There's a very known study in 2019 called the Global Burden of Disease that tried to examine the burden of different conditions. And they found that depressive disorders, anxiety disorders, schizophrenia, and other psychiatric disorders were like among the leading causes for disability.
Yes.
Especially among the young people. So when we're talking young people, we're also talking about people who are productive, people who are like working, have families, etc. So you can see the impact of psychiatric disorders.
Definitely. It's very prevalent in our society today, and it's something I think we need to start breaking the stigma around. You know, just like we go get checked out for diabetes, as you mentioned, and other things, it's really important to take care of our mental health. So we can say that depression and anxiety is something that's very normal for a human, right? Do you agree with that? Do you not agree with that? And I think the people that argue that think that medication is not so important.
I think the problem stems from terminology. So sometimes like the same word is used to mean different things. So the word depression is sometimes used like colloquially to mean sadness. So someone will tell you, for example, oh, I was very depressed yesterday because, I don't know, my team lost the game.
That's
so
right.
they don't really mean depressed in a medical sense. They meant simply that they were sad. So the first meaning of depression is sadness. The second meaning is a medical meaning. And in this case, depression refers to a set of symptoms that are used, like there are criteria to diagnose people with depression. So these are very different uses of the same word. Likewise, for anxiety, it's the same. So sometimes anxiety is used to refer to like normal anxiety, but other times anxiety is used to refer to anxiety disorder.
Right.
So, but there's a big difference between sadness and depression. When people are sad, there's always a trigger, there's always a cause. Sadness does not persist forever, so it's usually transient. It goes away as soon as the trigger went away.
Right.
Sadness does not really interfere with one's life. However, depression, actually, we don't really need sadness to diagnose depression. This is something people don't know. Sadness is one possible symptom of depression, but it's not needed to diagnose people with depression.
Right.
Depression alters someone's sleep, appetite, weight, alters one's functioning. So, and then the symptoms are persistent for at least 2 weeks. So there's a big difference between depression in a medical, like as a medical term, and sadness. The same applies to anxiety as well.
That's right. I think these are two very big words and conditions, and we tend to use them as humans very lightly, which I think is very unfortunate and makes us believe that we can just get rid of anxiety or depression, which is absolutely not true. We need to see a specialist and do a lot of things, which brings me to my next question. Can depression or even anxiety be overcome by someone just working on themselves, maybe with different methods? I don't know, whatever works for them, gym. What do you think?
Okay. So can someone with a fractured leg just get up and, you know, run by themselves? I think the problem also again stems from understanding what depression is.
Yes.
For example, let's still take the example of depression. When someone has depression, we're talking about someone whose mood is low, but persistently low, and this mood cannot cannot improve by itself.
Yes.
Also, we're talking about anhedonia. It's a core symptom of depression, which means that we are unable to experience pleasure. So whatever you do, you won't be able to experience pleasure. So how can you lift your mood if you can't experience pleasure? Something else that's very important, you know, PET scans, like advanced neuroimaging in the brain, show that people with depression have a hypofunctional, it's called dorsolateral prefrontal cortex. It's a structure in the brain that's responsible for rational thinking, for taking decisions, for organizing thoughts. This region in the brain is not working properly in people with depression. So how can they use their thoughts, for example, to change their symptoms? This is very, this is not something that they can do. I mean, anxiety is also almost defined by the inability to control your thoughts, the inability to control your emotions. So people with anxiety are not just able to, you know, get rid of their thoughts or their anxiogenic, anxiety-provoking thoughts.
Definitely.
I mean, these thoughts keep looping, and this is how we define actually an anxiety disorder.
Definitely, there's way more that goes into it, and I think it's really important to try and treat this. But other than the stigma around mental health, I think there's even a bigger stigma around medication of mental health.
Yeah.
You know, we've grown up listening to all these rumors and all the cons about the medication, and no one has ever shed light on the good parts and how it could work for us and sometimes even regulate our mental illnesses. So why don't we just treat you know, psychiatric disorders with just talk therapy? I think that's a question we need to ask to understand the importance of medication.
Sure. So I mean, answer by another question. Why don't we treat all cases of diabetes with, you know, exercise and diet alone? So we can't, simply because there are different types of diabetes and there are different severity levels of diabetes. The same applies to mental illness. So there are different psychiatric disorders and there are different severity levels of these psychiatric disorders. So for certain cases of diabetes, like very mild cases with like type 2, a certain type of diabetes, we can probably treat these cases with just, you know, exercise and diet. The same applies to, for instance, mild depression, mild anxiety disorders. We can usually use talk therapy or psychotherapy as a standalone treatment. But then for more severe cases, exactly like in diabetes, like we cannot use psychotherapy alone. Sometimes psychotherapy is not even possible, so we need medications. For certain psychiatric disorders, actually, medications are the core treatment. So they are the most important component of our treatment. Psychotherapy still helps, like in diabetes, like diet, exercise always help. But then for certain types of diabetes, type 1 diabetes, for example, insulin is the most important treatment.
Definitely. And I think that's something we cannot avoid, both for diabetes and mental health.
Exactly.
So to try and understand medication more, how can medication treat conditions that are purely psychological in nature?
I think the problem is that we always still have in our minds this dichotomy between the body and the soul. So we attributed easy to understand functions of the body, like digestion, you know, walking, etc., to the body, whereas we attributed things like, you know, thinking, emotions, etc., to something obscure, sometimes that we refer to as like the soul or something.
Yes.
Our problem in psychiatry is that we're dealing with the most complex organ in the body, which is the brain. So we can imagine that, okay, for example, if we have a problem in our lungs, the lungs are mostly responsible for breathing, for instance. So if you have a condition in your lungs, you won't be able to breathe properly.
Right.
Likewise, if you have a condition in your brain, at least in the parts that are responsible for regulating your thoughts, your emotions, your behavior, then you would have symptoms that involve changes in your behavior, in your emotions, etc. So this is, I mean, we are just treating the brain. And you know, the brain cells communicate with each other using chemical signals that are called neurotransmitters and using electric signals. And you know, I mean, another proof is that some medications that are used in general medicine, not in psychiatry, these are not even psychotropic drugs, some medications have psychiatric side effects. If you take some antibiotics, you can have some psychosis, depression as a side effect, even though it's an antibiotic supposed to just, you know, kill bacteria, but then it goes inside your brain and it can alter these signals between your brain cells, and it can cause psychiatric symptoms. So if drugs can cause psychiatric symptoms, why can't they relieve psychiatric symptoms?
Definitely. Well, I have way more to ask you about medication, especially when it comes to psychiatry. But dear viewers, we're going to be going to our report on self-improvement, and we'll be back with Dr. Sami. Dear viewers, we just viewed that report on self-improvement, and we are back to continue our interview for this evening with Dr. Sami Ouanes, the consultant psychiatrist. So right before the break, we were talking about medication, why it's important and how it could help. But what I really want to know about, and what I think people are scared about, is how does the medication change our emotions? So by taking these medications, can we say that we're creating artificial emotions? Is that okay? Is that normal?
So don't you think that depression also creates artificial emotions by changing our chemistry in the brain? So in fact, I think it's actually the opposite. So I mean, we usually see people in our clinical work with depression, for example, and when they get better on antidepressants, for example, or on psychotherapy or both, they tell us, well, I'm back to my normal self.
Exactly.
Now I'm back to my normal self. And even the families can perceive that very clearly. They can tell you, oh, this is my daughter now. I mean, you gave me my daughter back.
They can recognize the daughter again.
Exactly. So people are back to their normal functioning once they take a medication or something. And you know, I mean, after all, everything we do changes the brain's chemistry.
That's
so
true.
Even talking to someone we like, even, I don't know, like eating food we like,
Definitely.
even going out changes our like things in our chemistry. And by the way, talk therapy or psychotherapy also changes the brain chemistry in very similar ways to medication. This is why psychotherapy is effective. Without changing the brain's chemistry, it would have never been effective. But psychotherapy is effective because it produces, and this is like proven by, again, neuroimaging, advanced neuroimaging techniques. Psychotherapy will lead to the same changes as medication, but it will take more time than medication. But I mean, at the end point is restoring the normal functioning of the brain.
Definitely. And since it's doing that and changing the brain's chemistry, regardless if it's a positive or negative thing, won't these medication cause addiction in any way?
Okay, so the idea is that, okay, it's a very important myth, I think, that we need to dispel here. So most psychiatric medications actually don't cause addiction. Many of them actually help even with addiction. Very few can cause addiction, and even these very few medications are only used in a way that does not cause addiction. So they are used in very, like, with very strict monitoring, etc., and for very brief periods of time, so that they don't cause addiction. But the vast majority, again, of psychotropic medications do not cause addiction. And you know, there are so many like drugs that are not classified under the psychotropic drugs. They are used for in other fields of medicine. They can cause addiction, but people often, you know, the stigma around psychotropic drugs makes people think that psychotropic drugs must be addictive, whereas they are not.
Definitely, and I think that's why it's really important to always clarify these things with specialists and doctors, so that I think the patients understand more when it comes to these medications and they actually go seek the help they need. So why do many people relapse as soon as they stop their medication?
I think some people misunderstand that as like a proof that psychotropic medications cause addiction. But why do people with diabetes relapse as soon as they stop their insulin or their medications? Why do people with asthma relapse as soon as they, you know, stop their steroid sprays or something? No one said that insulin causes addiction. No one said that, you know, inhaled steroids can cause addiction, because this is actually not the case. So we're talking here about chronic conditions. So the idea that many people have about medical conditions is absolutely wrong. So most people think that most medical conditions are acute in nature, which means that I get sick and then there's, like, they call it in Latin, like restitutio ad integrum, which means that I'm back to normal. In most cases, this is not the case. Most medical conditions are chronic. And when we say that they are chronic, they need medication for long term. So as soon as you stop the medication, the manifestations of your disease or your medical condition will be back. And this just means that your condition is chronic. This is not the case for all psychiatric disorders, but there's like a good proportion of psychiatric disorders that's that are chronic in nature.
Right. So we have some people that are worried, and then we have others that actually do take their medication long term or even sometimes too long. What about those patients? And is it fine to be taking these medications long term?
So it depends, of course, on the type of medication. So we always, of course, recommend that the patient discusses this with their doctor. But in general, like long-term use of most psychotropic medications is not that harmful. It's not as harmful as some people might think. So there's no, usually there are no cumulative side effects in most cases. So usually it's safe to take these medications long-term. But then medicine, the art of medicine is the art of weighing pros and cons of continuing versus discontinuing a medication, for example. So I think in many cases, even though these medications are safe, in many cases, it's better to stop them if, of course, if you're like the doctor would know when and if like stopping the medications would be the better decision or not.
Definitely. I think that's something that we should refer to our doctor. We shouldn't be taking any decisions like that alone. So can we now say that psychotropic medication really do work? Or does it depend? How does that work?
I mean, they work as well as most other medications in medicine. So there are studies actually about this that try to answer this question. And these studies show that most psychotropic medications are on par in terms of efficacy with most other medications used for diabetes, for hypertension, etc. So they're even better than many commonly used medications outside of psychiatry in terms of efficacy. So, for example, antidepressants, antipsychotics, etc., are generally quite effective, of course, if used with the in the right indications. This said, not everything, not every single psychiatric disorder is easy to treat. It's like not every medical condition is easy to treat. So there are people who don't respond very well to the first line treatment. They need a second line treatment, a third line treatment, sometimes a combination of treatments. It's exactly the same in other fields of medicine.
Definitely. Finally, before we end this interview for this evening, I want to know, why do psychiatry have such a bad reputation after all? What's happening with that, and how can we fix it?
I think there's a proverb that says that we're the enemy of what we ignore, and I think that psychiatry is the most complex field of medicine, and the brain is the most complex organ in the brain. You know, when I personally studied medicine, and we studied, for example, how the kidneys functioned, or how the heart functioned, etc. I was amazed. Wow, this is very interesting. This is very complex. But well, all of these organs, are a joke compared to the brain. The brain is much more complex than all of these organs. So you see why, we ignore so many things about psychiatry, because psychiatry is very complex. Also, I think some people like things that are tangible, that they can touch or see. So whenever you're talking about things that are not very tangible to them, they cannot really understand you very well, or sometimes they can't even believe you. I think the media has also played a big role. Unfortunately, in movies, etc., we see that patients with psychiatric illness are often portrayed as dangerous, risky, unpredictable, which is actually not the case in the vast majority of cases. So that studies show that if you control for certain confounders, including the social status, the use of substances, etc., most psychiatric patients are not more dangerous than you and I, so they are not really dangerous. Also, psychotropic medications, for example, electroconvulsive therapy, which is actually a safe and very effective treatment that is sometimes used in psychiatry. These interventions are portrayed as being barbaric, which is not actually the case. So I think media has also played a big role in that. And I think the other problem is that there's not enough investment, even research-wise, in psychiatry. So even though psychiatric disorders are very, very common, like the proportion of investment funds going into psychiatry is still very small compared to other fields of medicine.
Hopefully all of that will change very soon with all the awareness. I think the whole world is now thinking and finally talking about mental health, so hopefully that's a good step. And Dr. Sami, thank you so much for being with us this evening.
You're welcome, thank you.
Dear viewers, we had with us Dr. Sami Ouanes, consultant psychiatrist, and up next we have a report on mental health. Stay tuned.